So tonight we are going to be learning about what does it mean to be a statewide leader for the United Spay Alliance. Esther Mechler is going to be talking with us. Esther is a graduate of Bates College and the University of Rochester. Esther majored in psychology and education with a career in guidance and student personnel. In 1990, she left the traditional workplace and began a program to end companion animal overpopulation. Spay USA was started with the goal of finding affordable, accessible spay-neuter services for anyone in need. The program grew from a single vet in Connecticut who gave a 50% discount for referrals to a national program with thousands of veterinarians, clinics, and programs. The program is now run by the North Shore Animal League. Esther recently worked with grassroots animal advocates to organize the United Spay Alliance, which is comprised of statewide networks of spay-neuter programs. USA is currently seeking leaders in several states. In conjunction with these efforts, a campaign to move the recommended age for feline spay-neuter back by 4 weeks, Feline Fix by 5, was started in the late 1990s. The Feline Fix by 5 campaign has earned the endorsement of the AVMA, AAHA, AAFP, and ASV, plus a dozen individual state veterinary medical associations. Also on our presentation tonight, we have Emma Barker. Emma founded Red Earth Design in 2001 and has transformed it from a solo organization to a full team of remote workers who provide support for clients and enjoy a caring and flexible work environment. Emma has extensive experience in WordPress, PHP, MySQL, HTML, jQuery, CSS, and has a gift for translating tech talk into understandable terms. So I would like to thank both of them for joining us tonight. And I am going to try and unmute Esther. There you are, Esther. Can you see the screen? And
I can see, yeah, I can see you now, which is great. That's also, I may have to ask you to mute and unmute, but I can see you at least.
Sounds great. Esther, we are ready to hear your presentation tonight.
All right, well, thank you so much and welcome to all of you. And a huge thank you to Stacy. She is tireless and inspiring and visionary, and it's been a joy working with her over the past few months. We also want to thank Kristen Petrie, Bree Lovell-Myers, and Krista Beutler for all of their work to make this a truly comprehensive and, yes, awesome conference. And to Erica White, Ali Aguilar, and Sarah Russum for their ongoing work with the team as volunteers, our sponsors, and to all of you for coming. Well, it's been 10 years since there was a national conference dedicated to the ending of the births of unwanted and unplanned litters, and high time for another conference. Thank you, Stacy, for suggesting it. Over the past decade, a number of state leaders and spay-neuter advocates have passed away, they've retired, or they've moved on. And I don't need to tell anyone here that in the past year, our world has turned upside down. And so it's been a very tough time for everybody. And as far as the conversation about pet overpopulation is concerned, spay-neuter has been replaced with an emphasis now on transport, adoption, rescue, and general wellness. All of these are important, but none of them is efficient or effective unless the baseline numbers of cats and dogs born moves down. Not unless we prevent the problems in the first place. And so we're gathered here today to see what we can do and what others are doing. To ask questions and share answers, to inspire and to be inspired, and to connect. So now for some history lesson. Back, I guess the first picture is of the United States, trying to show how big it is. The first one on the left here is back in 1990, we were euthanizing 1 million cats and dogs every month, 12 million a year. That was the year in response to that we started a program that we called Spay USA. This was a single toll-free line that connected callers with phone counselors who worked from a comprehensive national database. That program has been run by the North Shore Animal League since 1993, and I was the director till my retirement in 2010. The phone number is still active, and people still call for information. That's 1-800-248-SPAY. But our concern was that the country is so large and the landscape so fluid, with hundreds of clinics and programs starting up and phasing out, new veterinary practices starting and others closing every year. It's very hard to keep track of all of these programs and clinics from one place. It made sense that we could expand our base of knowledge if we could find people within each state to locate referral clinics, programs, disseminate information, and even organize statewide conferences to raise awareness within their own states. That's exactly what happened. The map on the right, I have to translate. The green states, a program is in effect and working. The red state, no state program that we know of. The yellow states, kind of in progress. And the white ones, we're really not quite sure what's going on. The leadership began to emerge. And by 2015, looking at this map on the right, there were about 20 states that had developed programs of their own. Among them, Mississippi, Colorado, Maine, Michigan, Arizona, and Florida. We incorporated the United Spay Alliance in 2015. And at this time, there are a number of states that are still organized, as you can see, or without any leadership. One of the unstated goals of this conference is to find strong leadership in those states that can set up an active, robust program and lead it. To help with this, we are turning to our wonderful colleague at Red Earth Design, Emma Barker, who has offered to set up a state website template for incoming leaders. She's already done a couple of these, and I hope she's going to be able to show you a little bit about how that's working tonight. We'd like to introduce Emma Barker here and have her speak about Red Earth Design and her offer of help to the states. Emma.
Hi, everybody. Today I wanted to talk to you about a program that Esther and I put together to help organizers coming in with the tech side of things. So if you need to get your word out and you don't have a website, we can help you set one up. So I'm going to share my screen. And here, I'll share this link after I'm done talking as well. This is just a summary of the program. Tells you what it is and what's included. And then it has a link out to the demo site. So I'm going to walk you through the demo that we set up with Spay, Pennsylvania as a sample. And we do, I think, need somebody in Pennsylvania. So we've already got a site started there. So you can add a logo here, and we started out with some basic pages, and you can fill in all of your content about why spay neuter, learning more, donation information. And all of this is customizable. We just get it started, and then we help you fill it in with whatever you need to add. One nice feature about this website is we also have the option to do locations by county. So you can drop in clinics and people can search by the county or look at the whole list. So they can do it by the map or pull up a filter by their county as you add more in. Then we have a page set up dedicated to why spay neuter, and then a page for more about your organization and contact information, as well as a page for donate. Now, this is what it comes with just by default. All of this is very flexible. So you can come in and remove some pages, add pages, whatever you need. This is built on a WordPress framework. So it's very easy to learn, but we also include training. So you can give us all the content you want to add, but we can also show you how to add it. So going forward, you don't have to depend on us. You can run with it after that. So I'm going to show you the builder that we use. So behind the scenes, we set up a builder called Beaver Builder. So when you come into a page to edit, and this is active at the moment on this page for the example, if you mouse over a section, it highlights it, and then you can click on it, and it pulls up a text editor, and you just start typing. So if anybody has used Wix or Squarespace, it's very similar to that in that you get to just click on something and it's there to edit. One advantage of this system is that it's responsive or mobile ready right out of the box. So you don't have to do anything special or do a whole different mobile version for your site. It just automatically looks good on phones right out of the gate. And you can also drag and drop things and move where they sit. You can add photos. You can add new rows. You can duplicate rows. There's a lot you can do with this builder. And as part of our time with you, we would show you how to use this. So with the program, we include just the basic pages. It's ready for search engine optimization. It's ready for mobile. We can add a blog if you want to add regular blogging and articles. And we're available for support as well. And with United Spay, they've accommodated up to 10 hours of our time. So we would set up the site, put in your content, your logo, your colors, and then do some training with you where we do a screen share and show you how to use it, and then get it all dialed in. And usually it doesn't take all 10 hours, but you have us available to you as needed. And if you come down here to sign up, it just is the hosting. It's all you would need to do. And then United Spay covers our time to get you set up. So this is very much like if you sign up for Wix or Squarespace, you would just sign up and the hosting's included along with the website. So it's a very similar system where you don't have to go sign up for hosting at GoDaddy or Bluehost or anywhere. It's just all included. So you only have one charge to worry about, and then you're good to go. So I will share this link, and it includes the demo site link, which is here. And it doesn't have to look like this site. It could look different. If there's a site that you like and you kind of want to emulate it, we can help you get there. So that's what we're here for. The other thing, so that's for people that don't have a website already, and we can also assist with domain registration. Esther has already secured a lot of domains or has them from other organizers in the past. If you already have a website and it's a WordPress website and you just want to lean on us for questions about updating something on your WordPress website, we can be a help for that as well.
So at this point, I'm just going to interject a little bit because we do have a couple of videos. And so with videos, if you are watching from a phone or if you're in a low bandwidth area, sometimes their videos will freeze. If that happens, just log out and come back in. We will have these videos available on the recordings. Hopefully by the fact that I'm mentioning this means that it's not going to happen, but I just wanted to let folks know that sometimes the videos will not agree with some folks' computer systems, but hopeful. But I just wanted on Friday night, it's basically, this is our tech check with everybody with 93 people in the room. And so, so we wanted to make sure we have some videos, and boy, the Feline Fix by 5 team, they have some fantastic videos. So we thought we would share them, and hopefully you're sharing them in your social media. So Kristen, I'm gonna flip it over to you to launch a couple videos.
The cat is out of the bag. Actually, cats everywhere are getting the word out that spaying and neutering before 5 months has proven health and behavior benefits. So, how about a high five for getting fixed by 5 months? Perfect.
I'm Dr. Steve Kinney of the Auburn Animal Center, and I've been a practicing veterinarian for over 35 years. Some interesting findings came to light in a recent survey about people and their pets. I was surprised to learn 3 out of 4 people were unsure of the proper age to spay or neuter their cat. This has led to millions of kittens being born. Some of them are abandoned, some of them are sent to shelters, and others need to be euthanized. Say hello to Fiona. She's a 4-month-old female. It's hard to believe, but she really should be fixed by next month. That's right, your cat should be fixed by 5 months of age. Why 5 months? Well, if fixed by 5 months of age, there is no chance that your cat can reproduce and lead to overpopulation. Female cats are 91% less likely to develop a deadly form of breast cancer if they are fixed by 5, and they cannot contract pyometra, which is a potentially fatal infection of the uterus. Male cats that are fixed by 5 months will not spray urine to mark their territory, and that's good news for everybody. They are far less likely to roam, be hit by a car, or fight with other cats, possibly contracting lethal infections. Remember, Fiona here is a kitten, but in a short time, about 30 days, she could be pregnant with kittens of her own. The simple idea of Feline Fix by 5 will prevent unwanted litters and save millions of lives. Go to our website, felinefixby5.org, and see how you can help. I really thank you, and Fiona here really thanks you. Right, Fiona? Huh?
Fantastic. That was great. So hopefully those videos worked well for folks. Let us know if you did have any issues and we can help troubleshoot it for the future. Esther, I'm going to unmute you and I'm going to let you continue on with your presentation.
All right, thank you, Stacy. So as we continue our introduction to this first all virtual national conference on spay neuter, I'd like to touch on the state of spay neuter across the country today. What are our successes and what are our challenges as we enter 2021? Well, the first success, I think, Fix by 5. This is a successful campaign that has been moving the recommended age for spaying and neutering back to by 5 months. And as Stacy mentioned, it's even been endorsed by the very conservative AVMA, as well as the American Animal Hospital Association, American Animal Feline Practitioners, Association of Shelter Vets, Catalyst Council, and the Cat Fanciers. What this means for preventing those first unexpected litters is huge. And it also means that many young male cats will not lose their homes because they started to spray and mark. So many cats in shelters end up there for that reason. And preempting those behaviors will help keep cats in their homes and reduce shelter intakes. So Fix by 5 really does reduce shelter intakes. And what we will be asking to do during the conference is to ask you to ask your vets and the general public and make them aware of this change. Next slide, please. These are 3 of our wonderful state leaders. On the far left is Ruth Steinberger, Spay Oklahoma, Oklahoma Spay Network, Sherry Storms in Indiana, and Sonia Hernandez in Arizona. And another bit of very good news is that we are just now starting to find new leaders in states such as Wyoming and Minnesota, Alabama and South Carolina, states that did not have leadership before. These are dedicated people focused on preventing unwanted litters and skilled at what they do. We welcome these new partners and look forward to working with them to create robust programs in those states. At this time, we're still looking for a good team in Pennsylvania and in New York, and some of the existing state programs could also use some volunteer helps. So we hope that some of you might step up. Next slide, please. And the barriers, the issues, things that keep us awake at night. The pandemic led to the closings of an unknown number of clinics and programs, some of them for many months. Some are still not open. So how do we catch up? Can we organize spay blitzes to perform hundreds of surgeries in a weekend? Are any of you doing this? It is doable, and this way of tackling the problem has been used often in the past, both in this country, in Panama, that's the blitz shown here, the spay blitz, and in Mexico and other countries with great success. If you show the next slide, I would like to just show, this is a flow chart for a spay blitz, and it's all laid out there, all the steps, all the ingredients that are needed. And I think for some of the areas where we still have a problem of a backlog of spay neuter surgeries that weren't done, we might think about organizing spay blitzes in those places. People who are interested can reach out to us for more information. Next slide, please. Okay, another problem over the past years has been the loss of focus on the prevention of unwanted litters. In the 1990s, there was much support for opening and running spay clinics and programs, and that funding support has now shifted to other arenas such as rescue and adoption. So how do we find ways to compensate for this loss and put spay neuter back in its key position to make all the other efforts more efficient? One answer is to create publicly funded programs. This can be a very effective model, but it's very difficult to set up, and it requires constant vigilance to prevent problems from poor leadership to hijacking to plain misconduct. A program like this can take a year or two to organize, sometimes more, and it has many pitfalls. If the program is administered by the wrong person or agency, it can easily lose effectiveness, and then there's nothing available. Because it has to be done right the first time, the United Spay Alliance is willing to provide model legislation and support for those states that are ready to take on this work. And in fact, this weekend we'll have 3 speakers addressing this model. So Stacy, I'm sure you have some things to add at this point.
On the next slide, Kristen, we'll talk about some of the things. These are some of the things that I'd like to share with folks, just to give folks an update of what's been going on with the United Spay Alliance for the last, oh, I guess it was August when we first
Yes.
started chatting. Yes.
Mhm.
And I don't even remember how we got talking, but it ended up being a conversation with regards to how should we collaborate with the Community Cats podcast. We for those of you who do know, the Community Cats podcast has a relationship with the National Kitten Coalition, and we've had a very successful kitten conference. And during the course of COVID, we had a lot of conversations. I was doing these pop-up panels about spay neuter, and I just really felt like we needed to have a dedicated conference around this topic so that we could continue to share and provide support to this group of folks that have worked tirelessly to try and keep their clinics open, to try and help cats, and to be able to better adapt to the changing environment in the world out there. So Esther and I decided to form a partnership with the United Spay Alliance and Community Cats podcast, and it's been a wonderful partnership. And one of the first activities that we did was work on this conference together. But in addition to that, we also wanted to work with promoting state collaboration amongst groups within the states. So United Spay Alliance previously had a model where there was a one designated statewide leader, and they were usually responsible for a lot of tasks, which is finding out about a lot of different programs, assisting people with calls and assistance, and really trying to do potentially a lot of work if it was a one-person shop. And in our sort of changing vision or evolution of what the United Spay Alliance is going to look like is that there may be several groups involved with a state project or a state page. So there might be one group might be handling email requests. The other group might be handling the research for the page. Another group might be writing blog posts. And it could be a group, it could be individuals. And so sort of trying to create maybe a more of a hybrid model where there's multiple layers of support. And so that's part of what our goal is to try and be flexible and adaptable in each of the state models, with the ultimate goal at the end of the day is providing the best possible information to folks that need assistance for their cats and dogs, meaning spay neuter assistance and other, access to veterinary care of other types. And so we have this vision of wanting to have about 10 or so researchers. We have a volunteer position for volunteer researchers. For each researcher would take 4 to 5 states, and they would do the research on those states, putting together lists, as well as sort of maintaining that list. So to volunteer to be a researcher with the United Spay Alliance, it's really a 3-month commitment to be able to do the research on those 4 to 5 states. And we have a template and a format. Erica White's name was mentioned earlier, and she's been doing a fantastic job with regards to researching states, so she could share her process. And if you do go on the United Spay Alliance website and you click on South Carolina, which is one of the new states that's up and coming, we actually do have current active, accurate information up on that state link. So instead of clicking on the link and saying there is no program, call back another time, you can at least click on that link and get access to current and up-to-date information. And that is our goal and our objective, which is to be able to provide that information. One of the things I'm not sure folks are aware of is that the PetSmart Charities Spay Neuter Locator, or it's actually the ASPCA Spay Neuter Locator, has gone out of business, I guess. I believe that was in partnership with the PetSmart Charities. And then I know also HSUS used to have a listing. There are a variety of national listings that were in place several years ago that are not anymore. There is Fix Finder, that's a national listing that's out there. Beth Frank is out there. She's on the call and runs that list. And so there are definitely other lists that we would like to collaborate with and work with. But we feel that a statewide immediate focused initiative is really going to be helpful. But we are open to collaborating and working with folks. And we definitely would like these volunteer researchers to be able to help support the statewide leaders so they don't have to worry about the burden of always trying to update that list on a continual basis. So that's our goal. We do have a link that I hope Kristen can throw in the chat, which will actually take you to a job posting that we have on the United Spay Alliance's jobs page, which is the volunteer position. And if you do know of anyone who might be interested in being a volunteer researcher with us, to please go over to that link and sign up. And also in that section, we are really trying to make the jobs posting section of the United Spay Alliance's website quite active. So if you do have any job positions open or board member, if you're looking to recruit board members, one of our initiatives going forward is to increase engagement with the United Spay Alliance to support the statewide programs, as well as have the statewide programs support United Spay Alliance and work together collaboratively. As a statewide leader, you would be involved with us on a quarterly basis for some quarterly calls with the other leaders. So you'll get support, national support, as well as benefits of being part of the United Spay Alliance. And if you are interested in any of these areas, feel free to email me at Stacy@Community Cats Podcast, and we can get the request to Esther and get it out where it needs to go. There you are. So there's everybody. And so one question that I saw that came up, Emma, was, could you get a little bit more specific about the costs that would be involved for, let's use the example of, yes, if they're using the template service, or if for some reason they want to just use you for their own website?
So if they want to sign up for the template site, they just have to sign up for hosting. So it'd be the same as if they went to Wix or if they went to Squarespace or somewhere, they would sign up for the monthly hosting. So it's $10 a month. If they just want our help with a few questions on a website, it's just United Spay Alliance covers a certain amount of our time. So if it goes beyond that, then we would just work with them individually on cost. So on an hourly basis.
Gotcha. Excellent. So one of the questions that I see here is, it's very hard to find low-cost clinics. They're overloaded. It's hard to do TNR if you have to schedule out 30 days or more. And Judy, I totally understand that we have some significant challenges and significant wait lists in a lot of areas, and how to work with triaging. That's a big challenge, and capacity is a huge conversation all across the country. I'm not sure what part of the country you're in, but I know in New England, we're faced with a lot of wait times, and it's very, very challenging. So I don't know if there's a magic wand for that issue, but I agree it's a big challenge, and I'm sure that's going to be a topic that will come up during the weekend. Tracy asked the question about California has 58 counties. Wouldn't that be a huge research project on its own? And I agree with that. Go ahead, Esther.
I was going to say there is a Spay California, and she might want to Google that because it's very comprehensive. It's listed by county, and just check that out because that's one of our green states.
Okay, so here's a website question. I have a very simple website with Weebly, and I'm not a techie. It's been the same for the last 3 years. I need advice on how to revamp or update the site.
Great. Yeah. So definitely reach out at help@redearthdesign.com, and we can take a look at the site and talk with you, get on the phone if that's easier, and talk about what you need in the new site and get you set up.
So I'm going to take this question because the question revolves around, are people aware of Haas and how Haas is a threat to spay neuter because it is about rehoming without spay neuter? And so HOS is a sort of a new movement, human animal support services. And it started sort of out of COVID and with the idea of really moving your services outside of the shelter walls and bringing services out into the community and trying to have it in an environment that's maybe a little bit less judgmental. I initially felt a lot what this person is saying, that the spay neuter conversation wasn't really on the table much with them. However, I participate on a couple of the committees, so I'm there on a weekly basis with them, getting to know the folks. And I would say spay neuter is definitely still part of the conversation, but it's not the only conversation. So in a situation where they want to create relationships and partnerships with folks in the community, providing wellness, access to care services for pretty much all components of a pet's needs. So we have to realize if a person can't afford a full price spay neuter procedure, they're not going to be able to afford dental. They're not going to be able to afford some of those other services. So I guess it's called this, it's more of a One Health type environment. So it's, you're developing a relationship with that individual person, and you're not saying we're only here for the spay neuter and that's the end of the story. So I think that's the more of the framework that they're going. I don't think that they are not supportive of spay neuter. I think that they believe it's a very important piece of it, but then there's definitely other components out there that are part of their conversation and part of what they're looking at. I mean, they have 52 working groups covering different topics, one being community cats, one being stationary clinics. You know, I'm in a group with facilities, so we're always talking about clinic design in as part of the dream facility. So, you know, if you're going to have if you're going to have a veterinary clinic, you're going to be doing surgeries there. So, you know, I'm looking at these clear plexiglass box things for recovery, so you can do more cats in a smaller space and that kind of thing. So there's definitely conversation, but it's not the only part of the conversation. So I'm not sure if that's helpful for you, but it's just one of the things where I'm trying to understand everybody's perspectives to be able to see, you know, where we're going. But I agree that the resources are moving away. Funding resources are moving away from direct immediate funding on spay neuter. It is getting more diluted into other social service programs.
Thank you.
Excellent. Great. All right. Well, we are going to close out a few minutes early, but we have an incredible lineup tomorrow and the next day. It's going to be busy, 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 busy. Lots of panels.